There are more than 7 million Canadians without a family doctor. But former federal health minister Jane Philpott thinks she has a plan that could change that. In her new book, Health for All, Philpott lays the foundation for what she calls primary care homes, a home base of sorts that Canadians can go to for all their health care needs, similar to how all Canadians have access to public schooling. Under Philpott's plan, all Canadians would have access to primary health care. I spoke to her last week. Jane Philpott is a former federal minister of health and currently director of the School of Medicine at Queen's University. Jane Philpott, it's good to see you again. Thanks for coming in.
Nice to see you.
Your book, you talk about a reality where every person living in Canada has what they call a primary care home. Mm-hmm. What do you mean by that?
Well, we know that there are close to 7 million people in this country who do not have either a family doctor or any other place to go to get primary care. They don't have a front door to the healthcare system. And what I am proposing is that we do what many other countries, particularly in Europe, do, and they guarantee access to everyone in the country to have a primary care team that is publicly funded, a place in their neighborhood to which they are assigned based on their geography, and when they move to another place in the country, they know they will have a place to go to get care.
Okay, you compare this to how the public school system works. So you move into a neighborhood, there's a school or a series of schools that you can sign up for, and that's where you go. So you're talking about a hub or a series of hubs, medical hubs, that you would sign up for, and that's where you go, and we build a system for medical care that's like education.
Doesn't it make so much sense?
It's pretty radical though, right?
It's radical because we've never done it. And yet we look at our school system and we know that no matter where you move in this country, your child will be able to have access to publicly funded education at the elementary and secondary school level. So we figured it out a long time ago for education. It's time to figure this out for primary care. As I say, there are many countries in the world that do this. Canada has never done that. We've never had that guaranteed access to a primary care team. And I believe the time is now to have that.
Okay, this though requires some fundamental changes in how the Canadian medical system is set up. For example, like, you go to a private doctor's office that is publicly funded, but that's a private corporation and a business. So we're talking about changing the employment relationship and the employment location of family doctors to make something like this work, right?
There would be optional ways that a province could roll this out. I mean, I think it needs to start with the federal leadership level to say this is what Canadians should expect. This is the standard. Every Canadian should have access to a publicly funded primary care team. As you say, there are different ways that you could do that. You could do it through changing and putting doctors in salaried systems so that they would work with a team. The important thing, though, is that there is accountability built into the local level to say when the community grows, we'll actually add a new primary care team because we can't expect the doctors that are currently working to continue to take on more patients as communities grow. But we've never intentionally made it possible and built a system like that for the sake of Canadians' healthcare.
No, sort of the only purpose-built systems are really hospitals and clinics that are run directly by governments or health boards, right? The family practices, for the most part, are organic. I mean, there's recruitment efforts to get them, but they've kind of spring up because individual doctors decide to
Exactly.
do it this way.
And it kind of worked for us for several decades, but it has clearly fallen apart. As I said, now about 22% of Canadian adults don't have a place to go to get that primary care. I think that this was building up over the last few decades. The pandemic, of course, broke things apart and they've never stitched back together. The problem is then there are lots of people who don't have a place to go to get care. So they're showing up in the emergency department, often with end-stage cancer or with heart disease that could have been prevented. So we're wasting money, of course, but we're also costing people their lives.
So a couple of things. Let's talk just a little bit about jurisdiction. You talk about the need for federal leadership on this, but the delivery of health services is provincial. And as you have seen, they're not getting along too well, the federal and provincial governments. And you point to the European models where you say this works. They have a different government structure. Some are unitary state, just one level of government sort of running everything, so you don't need to worry about jurisdiction. How do you get past all of that, given just the way Canada has historically worked when it comes to these things?
Well, it's an outstanding question, and that's one of the reasons why the last part of my book is about the political determinants of health, because it will take political will to build a system like this. this. There are a few ways that one could go about this. Historically in healthcare, we've seen that provinces have innovated. Way back in the day when hospital insurance and doctors insurance first came in, it started in Saskatchewan and then was adopted by the rest of the country and built into federal legislation. And if there's a province that wants to go ahead and install a primary care guarantee, that would be fantastic. None of them have done this yet. I think there may be one or two that might think about it, especially if they read the book. But ideally, wouldn't it be great if the federal government and the provinces and territories sat down together and said, for goodness sake, Canadians pay taxes to provinces and we pay taxes to the federal government. Let's get along together. Let's figure out a way that we can actually deliver a health system across this country that works with our shared jurisdiction over health. And I believe that it's possible to do that.
So even if you could find the political alignment to take on a task this large and agree on a proof of concept, a structure, a system, there's still the human resources challenge, right? You're the director of a medical school. There's doctors aren't going into family medicine. We saw a lot of them close their clinics, last week in Ontario to protest administrative burden and cost. There aren't enough nurses. There's post-pandemic burnout. People are leaving the profession. How do you overcome that challenge? Because that seems to be the immediate thing that needs to be solved before anything else can get fixed.
Well, you're quite right that it's one of the ingredients that needs to be solved. I don't think we can do this in a sequential way. We have to actually be working on designing and building the system, making the guarantee and promising to implement it at the same time as the health workforce deals with the issues about why our medical students are not choosing family medicine as a specialty. We also don't have enough primary care nurse practitioners, for example. So it will take some time to build that workforce. But the reality is that what we need to do is move more of the health workforce into the primary care space. At the moment, the bulk of the workforce happens in the illness care space, which is in hospital-based care. And as I said, we could actually prevent some of the burden on hospitals if we had community-based primary care where people had that access to care and the prevention and health promotion that's necessary to keep them out of hospitals.
That question, though, of why are so few doctors doing family medicine? I think the last time we spoke on the show, you were talking about expanding a program, offering more medical seats or medical school seats strictly for people who wanted to go into family medicine and work in Ontario or work in the area like Barrie and places like that, the Durham region of where it was situated. I mean, why aren't they going in and how are these sort of measures working to solve some of that?
Well, this is certainly an issue that I tackle in the book and propose a number of reasons why family medicine is a less desirable specialty. We're really excited about the program we've developed at Queen's University that attracts students specifically who are committed to family medicine right from the start. So innovations like that will really help. The fundamental challenge, though, is changing the conditions of work and improving those conditions because our medical students look at the overburdened state of primary care. They see family doctors who are burned out, who spend 20 hours a week doing their administrative work on top of their clinical work. So some of what I'm talking about in terms of improving the system is being able to develop a system that will be attractive, where the doctors will actually get a holiday periodically, where they will be able to sign out to someone else on the team, and changing the conditions of work so that medical students will see that it's a desirable place to practice, because I can tell you as a family doctor, it's a wonderful career.
Because just as a final point, I've not put the thought into it to write a book, but I always wonder why there isn't sort of a centralized clinic system. The government builds the building, takes the operational costs, puts the administrative staff in there, and then doctors can come in on a locum basis or a rotational basis to cover off needs, but they don't have to worry about any of the non-medical functions. That's kind of what you're envisioning here in a way.
Exactly,
right?
And you should have written the book because you're exactly describing the kind of thing that is possible. We don't graduate teachers from Teachers College and then expect them to go out and, find a place to be able to set up shop in a school and find a few other people that will work with them and develop an entire curriculum for themselves. We have systems in place for school, and that's exactly what we need when it comes to primary care.
Jane Philpott, always good to talk to you. That's Jane Philpott, former health minister and author of Health for All, a doctor's prescription for a healthier Canada. Thanks for coming in.
Thanks for having me.